Now, before we begin the actual eyeliner procedure, there are some precautions that you need to be aware of. You're obviously working very close to someone's eye. Extra precautions that should be taken. I always use some fairly thick gel eye drops. They can be purchased over the counter, single dose applicators. Put those drops in the eyes prior to the procedure. It just gives a nice thick barrier, protective barrier to the eyes while you're working around them. Now the eyelid skin still has 3 layers of skin: the epidermis, the dermis, and the subcutaneous layer. However, this area of the body, those 3 layers are the absolute thinnest. The epidermis on the eyelid is about 0.05 millimeters thick. It is very, very thin. So pressure, too much hand pressure on your hands on the probe will actually push the probe a little bit too deep, going into the subcutaneous layer, causing the pigment to migrate. Migrate means that the pigment spreads out. It doesn't stay in a nice crisp line. It's really not a good look. So you want to be very careful not to put too much pressure on the probe while you're working. While you're working, the probe would be at about a 45-degree angle to the skin. You don't want to go straight up. You don't want to be at a 90-degree perpendicular angle to the skin. And you don't want to be too horizontal. About 45-degree angle on the level of the skin. Now pulling, and you really want to stretch the skin tight on the eyelids. That will help you tremendously to get a nice crisp line. There are many variations to doing eyeliner. I would say that the most popular and the most common is to start the eyeliner at kind of a thin line to begin with, maybe staying right within the lash line. You don't want to extend all the way in the corner of the eyelids. This skin is just entirely too thin. It will not look good. It will definitely migrate both corners. You want to be very careful not to go all the way into the corners of the eyelids. You want to start about where the lashes start, about where the tear duct is. Typically I start very thin. Then you can get a little bit thicker as we go across, just to give the eye the appearance of being a little bit larger, a larger, wider eye. Now again, this is kind of subjective. A lot of it depends on what kind of look your client is looking for. Eyeliner can be made either as soft and subtle or as dramatic as your client wishes. Something like that gives a nice look for the upper eyelid. For the lower lids, my general rule of thumb is more is not better. As we get older, a thick eyeliner on the lower lid does not look very good. If your client has nice, wide open, round eyes, you can certainly start the eyeliner about where the lashes start, about where the tear duct is, and you can work your way all the way across. Working right in the lash line. You could even go a little bit thicker toward the outside. However, if they've already got nice wide round eyes, going too thick on the outside corner can be a little bit of a detrimental look. For clients with smaller, more almond-shaped eyes, then you would probably want to start somewhere around the beginning of the lashes, but stay right in the lash line. Don't come out of the lash line until you get to about the 2/3 mark. Then you can come out of the lash line, go slightly thicker, giving the appearance of a wider eye. Now again, as you're working, you will be pulling and stretching the skin. That will help you tremendously with getting the pigment down into the lash line. Typically the way I start is I start on the outside corner and work my way this way. I find it's easier to stretch the skin by using my left hand and my left index finger and pulling the skin at the corner of the eye. And then just working my way along in small sections. You don't want to try to stretch a large section of the eyelid. Stretch a small section at a time, work your way across, working your way right down into the lashes, in between each lash, as you get closer to the corner, to the inside corner. And keep that needle at a 45-degree angle to the skin. Now after you're done, it's not uncommon that little flecks of pigment will get in the eyes as you're working. You will want to have some saline available, some refresh type eye drops, normal saline type eye drops. Again, single applicator little containers, and flush the eye very well with the saline. The most important thing you're going to have to do, thing that you'll have to get across to your client, is they are not to rub their eyes at all. Rubbing can cause a corneal abrasion, as there are probably little pigment flecks in the eye. The pigment flecks can actually scratch the cornea. It's very uncomfortable to have a corneal abrasion. It's not going to damage anyone's eyesight. It's not going to harm their vision. It's not going to harm the outcome of the eyeliner. However, it is very uncomfortable and painful and inconvenient, to say the least. That eye would have to be patched. And someone would probably have to be treated by a physician to patch that eye and treat that corneal abrasion. So, most important thing is you stress to your client they are not to rub their eyes at all for at least 24 hours. If their eyes start to feel dry or itchy, or if it feels like something is in their eye, then they can certainly flush their eyes with any kind of eye drops at home, but no rubbing. Lower lid, I generally do the same thing. I start in the outside corner and work this way, again stretching with my left index finger and thumb a very small area of the eyelid and filling that in. Then I move to another section of the eyelid, stretch, and fill that in. And I just work my way across, getting thinner and thinner as I get to the inside corner. I'm just working directly in the lash line, filling in between the lashes, making the lashes look thicker and darker. That is essentially what the lash enhancement is. And then working my way slightly thicker toward the outside to give an illusion of a wider, more open eye. When I start the eyeliner procedure, I'm stretching with my left hand, index finger and thumb, just stretching small sections of the skin, starting on the outside corner. And again, the probe at a 45-degree angle. And you're just making very small circles that overlap themselves. You will just move the probe in a very small circular motion, again while you're stretching. By making the small circles, you ensure that the layers of pigment overlap one another, giving a nice solid appearance. This tissue, again, is extremely thin and very easy to overwork. You want to be very careful that you are watching the skin, making sure that the texture remains smooth. If it starts to look very rough, or if the skin starts to look very abraded, like the texture of velvet, something very rough, then you've begun to overwork that tissue. That can cause a lot of damage. You want to stop working before you get to that point. Stretching the skin and keeping the probe at a proper angle will prevent overworking of the skin, moving in a slow, steady, even pace, applying even pressure, making small circles will give you a nice, filled in, solid look. You don't want to move too fast. Moving slow and steady with even pressure will actually give you much better results at a much, it will actually be faster than moving too quickly and risking damaging the skin. So slow, stretching only small areas at a time, 45-degree angle, small overlapping circles. That will produce a nice, even, solid eyeliner. Mid corner, stretch a small area, 45-degree angle, slow, steady, light pressure in a small circular motion with overlapping circles. And then move on. Stretch another small area and start overlapping, slowly overlapping circles again. So now that you've seen the eyeliner technique, let's go get our client ready. What we'll do initially is put some topical on. That topical will sit for a few minutes before we start the procedure to make our client as comfortable as possible. So let's go get started. Okay, so we decided that we're going to do upper and lower eyeliner. So what I'll do to start with, and you've taken your contacts out, we don't want to do this with contact lenses in. I'm going to start by putting a few drops of a thick gel in your eyes just to protect them while I'm working around them. And this stuff is pretty thick, probably will make your vision a little bit blurry, but you don't have to worry about that. We'll flush it all out before you leave. I'll have you look up and put the topical on your lower lids. And then you can close. And here it comes on your top lids. So this will have to sit for about 10 or 15 minutes or so. And it can feel a little tingly and stingy on the surface of your skin, and that's perfectly normal. Just keep your eyes relaxed, closed. Okay. And I'm just going to let you relax back here. I've got a little timer set, so don't feel like I've forgotten all about you back here. And I'll be right back in with you. Okay. Okay, so now we're ready to start eyeliner, and I'm going to start on your left eye first. And while I'm working on the left side, I'm going to leave the topical on the right, so I just want you to keep your right eye relaxed and closed. Okay. And while I'm working, I'll be pulling and stretching on your skin. So if I pull your eye open and you see me or you see my bright light, that's perfectly fine. Just try to stay relaxed. need to get just a little more topical on my hand. Get with it. Okay. This is just another type of rotary machine. It's a little bit different than the one that I used for eyebrows because it takes standard loop bars. It's also just a little bit quieter. And this is a textured 8-round probe that I'm using. What I do is I start by going over just above the eyelashes so that some pigment shows when she has her eyes closed. There'll be a little bit of pigment that shows above the lashes. Then I'll work my way down right into the lash line and do the lash enhancement. You doing okay?
I am.
Kind of a weird feeling?
It is. Certain areas a little bit more sensitive than others.
Okay. We'll put some more topical on as I'm working. This is just topical that I keep on the back of my hand on my glove so that I can use it for going over any little tender spots while we're working.
So you can see there's a nice line on along the lid, right along the top of the eyelashes. Okay, so now we'll work our way down into and underneath the lashes. Sometimes, depending on how thick someone's lashes are, it's a little harder to actually do a line type of movement. It's easier to do more of a dotted type of movement. So you're kind of placing the dots basically overlapping and one right on top of the other so that it fills in the area between the lashes. It just makes the lashes look thicker and darker. Yeah, it's a pretty strong topical. Sometimes you'll still feel a little stinginess, most often in the corners, but it shouldn't be anything unbearable. you're doing an area like eyeliner where you have to go over the area usually more than once, it's important to work slowly and to traumatize the tissue as little as possible. You don't ever want to just rush across. That ends up just damaging the tissue. Then you get a problem with swelling, even some bleeding, and that just all makes the procedure more difficult for the person doing it and for the person who's having it done. Drops in that eye. A little bit, there you go. That's easier said than done. lower lids are a little bit more difficult to stretch, so I generally put my thumb kind of at the corner of the outside corner of the eyelid and just kind of pull outward. You can usually get a good enough stretch that way. So if your fingers are small enough, you can get another finger in there and kind of stretch toward the inside corner. Now let's put a couple of drops in this eye. These drops that we put in are really good about bringing any little pigment particles to the corners of your eyes. So that's what I'm dabbing out right now. But if you see little flecks of dark in your corners of your eyes when you get home, don't panic, don't worry about it. It's perfectly normal. Just dab them out with a Q-tip, not your finger. I'm going to let you relax with a cold mask on for a few minutes.
Okay.
Okay, so we're just going to put some cold, wet pads on your eyes. And here's a nice cold mask. And this will help a little bit with the tenderness and puffiness. Okay, so I'll just let you relax back here for a few minutes.
Sounds good.